Hello, everyone. Welcome to This Conversation Matters podcast. And I'm Dr. Susan Protasio, your host. And for today, we have a very good topic. We will be talking about hallucination and delusion in Parkinson's disease. And in Parkinson's disease, these hallucinations and delusions, they're not often talked about. So it is a very complex disease. So my guest today, she will share her wisdom with us and her knowledge. And she was also my guest in the previous episode about holiday blues. So let's welcome her. She is a geriatric and adult psychiatrist who has more than 2 decades of work and experience in mental health care. And she has earned multiple awards in her work in Loma Linda, the Department of Psychiatry. So let's welcome our guest, Dr. Carolina Osorio. Welcome back, Dr. Carolina.
Thank you so much, Susan, for your introduction. I'm so happy to be here one more time to be able to share with all of you some of the knowledge that I have acquired through years of clinical practice and training.
Yeah, it's so nice really to have you. So could you make like a short introduction of yourself for those who don't know you yet?
Sure, yeah. So I did my psychiatry residency training at Loma Linda, and then I did a fellowship at UCLA on geriatric psychiatry. I spent quite a good amount of years working at Loma Linda with geriatric psychiatry patients. And so I did have a lot of Parkinson's patients under my care when I was doing that.
Yeah, that's nice. So Parkinson's disease is the fastest growing degenerative disease in the world. So can you give like a brief overview of what is Parkinson's disease?
Absolutely. So Parkinson's disease is considered something that we call neurodegenerative disorder. What that means is that it's a disease that affects your brain, the neurons that are the cells of your brain, and with time it gets worse, hence the part of the word that says degeneration, because it will continue to worsen with time. So in Parkinson's disease, what we see is an abnormality in accumulation of a protein that will affect the neurons. And once these neurons kind of start dying and being damaged, the chemicals that these neurons produce are starting to go down, and these chemicals are very important in order for us to maintain health. And so some of them, and the most common one associated with Parkinson's disease is dopamine. And dopamine is associated with the way how we move our body and also the way how we experience the world and the way how we feel in terms of emotions.
Right. And then as you mentioned, the motor symptoms, those are oftenly discussed, but the non-motor symptoms like hallucination and delusion in Parkinson's, they are not often discussed or talked about.
Absolutely.
So what is hallucination?
Right, so those are part of the known motor symptoms of Parkinson's. Hallucinations is a symptom that is manifested by the false perception of our sensory. So for example, our senses are vision, smell, taste, feelings in your skin, what we hear, and so hallucinations will be like an abnormal perception of those senses.
Okay, and how about delusion? What is delusion?
Delusions are also part of the no motor symptoms, and delusions are what we call a set of false beliefs. So the most common one is what we call paranoid delusions, where people start believing that they're being chased by, someone in particularly, or they are afraid because maybe my husband or wife is going to cause me harm, even though these beliefs are not based on reality.
Right. So they believe that it is true, but actually it is not really happening. Okay. From the website of Parkinson's disease, it says 20 to 40% of people with Parkinson's reports the experience of hallucination or delusion. So what do you think are the causes or cause of those hallucination and delusion in Parkinson's disease?
Yeah, so in the past, we used to believe that these symptoms were caused only by abnormalities in the dopamine system. But we know today that is not necessarily true. So it is part of the disease process because these neurons that are dying and the neurotransmitter that are being affected are causing these these patients to experience these symptoms. So now we know today that is besides dopamine, there is also serotonin that is abnormal in Parkinson's that causes the patients to have these experiences.
Okay. And when we say neurotransmitters, are those referring to like chemicals on the brain?
Right. So I'll just give you a very simple example on how the brain works.
Okay.
So you want to think of the brain as this big area
Okay.
where we have the neurons, which are the cells,
Okay.
and the neurons have to communicate from one neuron to the other one.
Right.
And so they have what I call it in a very simple way, either roads or highways. So the neurons produce these chemicals and then they're sent out through these pathways that I call, roads or
Right.
highways.
Right.
And then there are transmitters or these chemicals that we're talking about. They will go from one neuron to the next neuron. And this way they communicate and it makes our body, be well and
Yeah.
healthy and functional.
Yeah.
So these chemicals are dopamine,
Right.
serotonin.
Right.
There's another one that we commonly use called choline, which is the one that is involved in our ability to have memories. And there is also another one called GABA that is has to do with our ability to feel relaxed and calm. So these neurons are dying. These pathways, these highways are also being damaged, and the neurotransmitters go down. So all this combination is what is causing a lot of all these Parkinson's symptoms. It's a very complex disease.
Yeah, it is. So based on your explanation, so if the neuron is dying and then so now this part cannot connect to this part. So now since there is no connection, then whatever the movement that is supposed to happen doesn't happen, right? So
Yeah, so in a simple way,
Yeah.
when we talk about motor movement,
Yeah.
walking, moving our bodies, the dopamine, we need to have good levels of dopamine, and this
Right.
dopamine has to move from one area to another so that we can actually move,
Right.
in a
Right.
conducive way of having
Yeah.
good life.
Right. So does also medication has effect on their symptoms in Parkinson's?
So again, in the past, we used to believe that the medications, because in Parkinson's your dopamine goes down,
Right.
the treatment is to give dopamine, right?
Right.
Supplementation of that dopamine.
Right.
So if you have too much dopamine, then you can hallucinate.
As a side effect from very
Correct.
high dose.
You can hallucinate or have delusions. But today we know that the medication itself is not causing these hallucinations or delusions, because the hallucinations and delusions of Parkinson's are also secondary to abnormalities in the serotonin system.
Okay.
But very high
doses.
dosages of this dopamine medication can exacerbate or magnify it. And so it's very common that sometimes we do decrease the dose of the dopamine, but we don't stop it completely.
Right. Because if you stop that medication, dopamine, then the patient will not be able to move.
Correct,
And
yeah.
that is already the problem in Parkinson's disease.
Right.
They have slow movement, rigidity,
Right.
and so you have to maintain that movement.
Right.
Then I wonder, how about underlying health conditions on the patients with Parkinson's? Can that be also a cause for the hallucination?
Yes, so, sometimes, so hallucinations and delusions are symptoms, and they can be caused by many things.
Right.
There are medications that can worsen those things, not only the dopamine medication, but there are other type of medications that can worsen that, that kind of symptoms.
Yeah.
We know that people who have, at the same time of having Parkinson's, they have depression and anxiety. They do, these two other conditions can also worsen or cause these kind of symptoms in people with Parkinson's.
Right.
There are also things like environmental things. For example, we know dehydration can make people feel delirious and people hallucinate. So, taking care of your lifestyle is also going to be incredibly important to minimize and mitigate a lot of these symptoms.
Yeah, and that should be recognized by either patient or the caregiver, because like you said, if they're having hallucination but secondary to dehydration, not necessarily the medication or the Parkinson itself.
Yeah.
It could be other causes,
Absolutely.
right? So not everyone with Parkinson's will experience hallucination or delusion, right? So are there other risk factors that, increases the risk to develop hallucination in patients with Parkinson's?
Yes, I mentioned, right, having depression, having anxiety, the environmental factors, being on other medications. age is if you have Parkinson's when you're much older, then you have a higher risk for these hallucinations. Right. Also, if the Parkinson's disease is the longer it stays, then the worse will be later on in life to develop hallucinations.
There's a higher risk.
It's a higher risk for hallucinations and delusions, yes.
So what are those different hallucinations that are seen in Parkinson's disease?
Right. So about 10 to 30% of individuals are going to experience what we call visual hallucinations. So visual hallucinations are seeing things that are not there. Yeah. And it's very common in Parkinson's. Patients will come and be very detailed in the way how describe these hallucinations. Usually they're going to see children or they're going to see animals. And many other types of visual perceptions that are not real.
Yeah, that is true, because I have interacted with someone with Parkinson's for 18 years. And when he got home, he opened the door of his house, and in the room he saw like snakes, lions, and all those kind of animals. And so he was so scared, he has to call his friend, say, hey, come over, because there's so many animals. And then when the friend, of course, came, there's none, right? Right. And then also the auditory hallucination, I've seen one that has expressed that says, oh, at night I could hear voices coming from the wall.
Yeah, so about 35%. So about 35% of hallucinations are going to be what we call auditory hallucinations, which is what you described. Right. And then the other type of hallucinations is what called presence hallucinations.
Right. Yeah, that presence hallucination. I talked to someone, he has Parkinson, the same person that I interacted with. And it was like, I think what he described was like a month or 2 months before the death anniversary of his father. And then he said, you know what? I was cooking in my kitchen and I felt like there's someone standing behind me. Right. Yeah. And he started crying, and because probably he thought it was his father that passed away, but I think it is the presence hallucination.
Correct. Yeah, and that's it's common, but people don't talk about it.
Right. Yes, they don't. So I read an article that said it is not uncommon for people with Parkinson's disease to remain silent with their experiences, and only 10 to 20% actually report these symptoms to their physicians. But some people may not know what are those symptoms. So what are the signs and symptoms of hallucinations and delusion that they should pay attention to? So let's say hallucination.
So if the patient is not, let's say I have Parkinson's and I'm hallucinating, but I don't say this to anyone. Yeah, right. So it might be possible that my caregiver, my family member might see me talking to someone else that is not there, or I might be just grabbing things in the air. Maybe I'm trying to move animals or bugs, which are very common. Right. So those are some signs that we can see in someone experiencing Parkinson's.
Yeah. So hallucination is treatable. So how do we treat or manage hallucination?
Yeah. So hallucinations or delusions, they both are going to be treated the same way. Okay. So first of all, you need to be sharing this information with your loved ones, caregivers, or doctors. I know like it's very hard to talk about these things because we have this idea that hallucinations and delusions are part of mental illness. But hallucinations and delusions, they're just a symptom. It can occur in many different circumstances. So Parkinson's, you can experience that. That doesn't mean you have a mental illness. So if you feel more comfortable, share with your doctor. We do have treatments that are indicated in terms of medications that can help very much with these symptoms. But the other things, in order to manage these symptoms, are to control for other factors that I had mentioned before.
Right. And it's very important to share it with their healthcare professionals if they, let's say the caregiver notice the subtle signs or the early signs of hallucination, because normally it's the caregiver first or the family members that will notice it, because of course the patient probably may not be aware, right?
In Parkinson's, early on in the disease, patients are very aware of these symptoms.
That they are experiencing
it. Yeah, and it's more like sort of like an embarrassment to talk about it,
That
because
don't
they don't
say.
want to be labeled as having a mental illness, which they don't have.
Yeah.
And so that's why it's so important to share this information with your doctors. There's nothing
Yeah.
wrong with having these symptoms. It is just part of the disease. It's just like having,
Right.
stiffness or tremors.
Right.
It's just another
Right.
symptom.
So, how do we balance that? A patient with Parkinson's disease receiving treatment for Parkinson's, but then at a certain point is manifesting hallucination and delusion. So, how do we balance that treatment of the Parkinson's so hallucination or delusion doesn't occur? How do we?
Well, the most important thing is to talk to your doctor, because
Yeah.
they are the ones who are going to guide you and give you the resources and the changes that you'll have to
Right,
make,
right.
and if you need medications or if they need to adjust the medications. But if you don't share with your doctor that you're experiencing this, that doctor is not going to be able to help you, either by changing medications, adjusting medications, or giving you other ways that you can prevent or decrease or
Right,
eliminate these symptoms.
Right. So, delusion in Parkinson's, as you mentioned, how it's the same thing as like a symptoms of Parkinson's disease, psychosis. So, how is it treated? Same thing as
Hallucinations,
Hallucinations.
yeah, medications and controlling for medications,
Yeah.
making sure that you're moving your body, that you're drinking water.
Yeah.
Constipation is another big risk factor for worsening hallucinations and delusions. So making sure you're going to the bathroom on a regular basis.
And also the most common delusion symptoms is persecutory or what's the other one, like jealousy?
Yes.
So how does the caregiver or family member deal with that? Any advice or comments
Yeah,
on
so
that?
the caregivers are our most important resource
Right.
for doctors when we deal with patients who have medical problems in general, especially medical problems that are so debilitating like Parkinson's. And so what I would say, and this is what I tell my patients, families, and caregivers, and even though I know it's very easy for me to say it, but don't take it personal, because this is not, so if I will give you an example. I had a patient that she believed her husband was cheating on her and that he was bringing women into her house, you know, to be there with him. All of this was not true, right? But imagine you've been married for 20, 30 years, and now your loved one is accusing of these things. So know that this is not your loved one, because if your loved one wouldn't have this disease, they wouldn't be accusing you of these situations. And so be mindful of not taking it personally, and really thinking about how this disease is affecting your loved one, and at the same time the whole family.
Right. Yeah, and they should, I would say, increase their patience, although it is easy to say,
Yes.
but it is very, very
Correct.
difficult because it's very stressful.
Very
and the
stressful, yes.
Family members, and also, especially if the caregiver is the spouse or the significant others, So, if there is one thing you want to share with our audience about hallucinations and delusions in Parkinson's disease, what would that be?
Well, talk to your doctor, because it's treatable. You don't
Yeah.
have to suffer in silence. Share with your doctor, and they will find ways to help you with that. Don't let it to advance too much, because the longer you experience it, the worse they're going to become, and then the more difficult they're going to be for us to treat it.
Yeah.
So if you talk about this early on, we're going to be able to help you in a more meaningful way.
Yeah. And is there that, is that activity the big and loud something? What
Yes.
was that?
So I mentioned this when we were, talking about
Yeah,
doing this
what was that?
podcast. So it's Shout and Loud, and it is a type of speech therapy. But I really, really like this, and this was brought to my attention by one of my patients.
Okay.
Because what they do there, Parkinson's, one of the problems that they have is all the muscles in your throat get affected, your vocal cords,
Okay.
your ability to swallow. But it not only does the speech therapy itself, but also they make you move your body. They have sort of like a big support group. And people with Parkinson's either the patients and the caregivers should be involved with support
Right,
groups,
right.
because it is so much better to be around people that are experiencing the same problems, because you can relate, you can have
Right.
better empathy, and then you can have advice from other people that are going through the same thing. So that is one of the organizations or activities or treatments that exist out there. But you also have the Parkinson's Disease Association and many other groups that you probably want to check in your communities.
So they could find it online, the Big and
Yes,
Loud?
they can find it online.
It is
yes,
online?
yes.
Okay.
Yeah, so I think you just type Chat Out Loud Parkinson's disease,
And they would see
and it will come up. Yeah.
in the community, wherever
Yes,
the resources.
yeah, and then on their website they have different places where they're giving this type of treatment.
Oh, so that's wonderful.
Yes.
Because patients with Parkinson's, they need to interact more.
Absolutely.
you
Yeah,
know?
don't isolate.
Yeah.
Isolation it actually worsens everything
Yeah.
else. So do not isolate. You don't have to be like been socializing all the time, but
Yeah.
be around
Yeah.
people that can be of support
Yeah,
to you.
that is so true. So thank you so much, Dr. Osorio, for this very informative conversation. Thank you for sharing your
Sure.
knowledge. And I hope Dr. Osorio and I have given you a clear understanding of what is hallucination and delusion in Parkinson's. And also, we were able to communicate with you how challenging this situation is for the patient themselves, for the family members, as well as the caregivers. So know that help is available, and like she said, that you have to seek professional help at the early signs of hallucinations and delusions. So before we end, let me share this quote with you. And this quote, I got it from this person, a software engineer, Urs Bratzi, who was diagnosed with early onset Parkinson's disease. And he creates beautiful artwork using pasta. And he said, "This disease awakened me. I now internalize the belief that we have one life, and it is up to us to make it meaningful. Parkinson's has become a driving force, motivating me to achieve." So I think that was so profound and beautiful and uplifting. So thank you so much for watching. Take care of yourselves, and I'll see you in the next episodes. Blessings.